Okay, good morning, everyone. Welcome to our webinar. My name is Hélène Ouellette-Kuntz. I think, Lynn, we can start moving to the next slide and launch the webinar. So our webinar today is on promoting intersectoral collaboration to support adults with IDD who are frail in the community. And as I mentioned, my name is Hélène Ouellette-Kuntz and I'm a professor at Queen's University. Today, there's three of us presenting the webinar. I'm joined by my colleague Lynn Martin, who's a professor at Lakehead University, and Tori Barbarash, who's a graduate student in our Masters of Epidemiology program here at Queen's University. We acknowledge and are very grateful to the Seniors Health Knowledge Network for their making this webinar possible for us, and to Julia Miller in particular for helping with the technical side of things. If you have any problems throughout the webinar, you can contact Julia through the chat box, and she'll be able to help you with any technical issues. So we also acknowledge and are very grateful to the support provided to us by our funders over a number of years to facilitate the work that we've done. They include the Canadian Frailty Network, RENA, and Mary Center. And we need to point out that the views expressed in this presentation are ours, those of the researchers, and do not necessarily reflect those of our funders. We will attempt to make our webinar interactive so to engage you in this process. And in order to do that, we'll have a few polls like the one you see on your screen now. So if you could, just as a practice, if you could try this out, and the poll will be open in a minute and you'll be able to answer the poll. And so indicate the number of people at your computer. All right, so Julia, I can't see the responses, so you'll have to tell me when the poll is completed and ready to be closed. I see people are answering in the chat. So I'm not sure how the poll is working. Julia, you'll need to clarify that for me. Okay. All right. So we see that 79% of you are alone at a computer, but a number of you are in groups. So that's great. What we'll want to do if you are in a group is when we are opening the subsequent polls, is that if you can have a brief discussion with your group at your computer and come up with a consensus answer, then you would select that response in the poll. And then if you don't have consensus, then we'd ask that the main person at the computer get to post their answer and then add a note in the chat about the discrepancy in your group or the debate in your group about the particular poll that we're suggesting. All right, so we'll move right along then. Oh, there we see the results. Okay, thank you. We can move that. Great. So our agenda for today is to talk very briefly about the context of our work, how we got to looking at intersectoral collaboration to support adults who are frail with IDD in the community. And then we'll talk about what we're learning about frailty in this population, review principles and recommendations to guide action on frailty for this population, and then finally end with the focus on the key elements of effective intersectoral collaboration in the context of supporting adults with IDD who are frail in the community. All right, so as most of you are likely very aware of and knowledgeable and well-versed on this issue, adults with IDD have more health problems and mental health issues than what we find in the general population. And not only do they have more of these problems, but they're more likely to have many problems co-occurring, so the notion of multimorbidity. This often leads to medication use to treat these conditions, and what we know of as polypharmacy, so multiple medication and the problems that can lead to. We also know that they are higher users of healthcare and healthcare services, But which is not surprising given that they have more health problems. But what we're also learning is that they experience more healthcare disparities. So despite needing more healthcare, they are less likely to receive quality healthcare to meet their needs. So we have a major challenge with ensuring access to quality healthcare and appropriate healthcare for this population. And then we also know that adults with IDD are aging. Just like everyone else in the general population, we have observed an increased life expectancy in this population, and we're seeing a greater proportion of the population with IDD being older. And that leads us to want to look at services differently and in the context of health issues as well. But unlike the general population, what we are learning about aging in IDD is that there is the experience of premature aging. So we will see signs of aging earlier in this population. And they also have a higher use of aging care services, such as home care and long-term care. And they use those services at earlier ages. We move on to the next slide. So what we know about aging generally, or how we think about aging and try to understand aging in the general population, more and more is to this construct or concept of frailty. And frailty is age-related health decline. So it's about a number of vulnerabilities that an individual accumulates over time through aging that touch on many domains of a person's life: social, physical, psychological, cognitive areas of one's life that add up and that accumulate and get us to a point where we see quicker decline and greater risk of health problems. So it's a concept that's used to characterize health complexity among older adults. So we can probably all think of in our minds of a frail older person. And typically in the general population, we're thinking about people over the age of 80, over the age of 90. In fact, roughly 11% of adults in the general population over the age of 80 are frail. So many people age without becoming frail, but it is something that starts to happen as people get older and older. So our question then, being concerned about aging and intellectual disability and access to healthcare and so on, a question that we asked ourselves was whether frailty could help us understand the age-related health needs of adults with intellectual and developmental disabilities. So we first set out to measure frailty among adults with IDD, and we reviewed the literature to find measures that existed and found that there were only 3 groups across the globe who were looking at this particular concern and trying to measure frailty in this population. And we learned that there general consensus on what frailty is, but different ways of measuring it. And there's 2 main approaches. One is the phenotype approach, and the other one is accumulation of deficit approach. So the phenotype approach to measurement sort of gives us very, very specific things to look for in an individual, and they're all in the physical domain, having to do with mobility, with strength, and those sorts of things. Whereas the accumulation of deficits approach is based on the notion that you look at how losses or stressors accumulate over time, and that there's a tipping point at which time one becomes frail. So we use the analogy of the Jenga block to sort of explain this way of thinking about frailty, in that you can have people will have different stressors or deficits, and at some point having one more of these deficits will cause the tower to fall apart. So we'll put one over the edge, so to speak, and make a person frail. So it's not any one specific stressor or deficit, but it's the fact that they've accumulated to a certain point. So we developed a measure based on that approach, the accumulation of deficit approach, and we used home care data in Ontario to do so. And our measure has 42 items, and it's been validated for use among adults with IDD using home care. We use that measure, the Home Care IDD Frailty Index, to learn about how common frailty is among adults with IDD, to understand the factors that are associated with frailty in this population, and also to consider what happens to individuals once they become frail. So there's our first real poll. So we have two questions in this poll, and they're true or false questions. So we'd ask you to answer them on the poll here. As I mentioned before, if there's multiple people, you can go to the chat box to indicate that there's disagreement in your group. So the first question is, frailty occurs among persons with IDD as it does in those without. True or false? And then our second poll is, among persons with IDD, those with Down syndrome are more likely to be frail. True or false? So again, I'm going to have to rely on you, Julia, to let us know when we have sufficient answers to reveal poll results. Okay. So frailty occurs among persons with IDD as it does in those without. 64% said true. Well, the answer is not quite true, because we know that the deficits are not actually the same. We have to think of those deficits or those stressors a bit differently among individuals with IDD. And that's because they often already have lived with a number of the deficits that are typically thought of in relation to frailty. So some of the mobility impairments or cognitive impairments that people have lived their entire lives with are not necessarily the things that will make them frail unless there's a change in that. So that's why we have to think about frailty a little bit differently. So not the same deficits, but what we've also learned is that it's more common in adults with IDD and at much earlier ages. So the answer is not quite true. It's not quite the same. Next poll question was, among persons with IDD, those with Down syndrome are more likely to be frail. 57% said yes, said that was true. And that in fact is what our early research has shown, is that adults with Down syndrome, when we compare them to other people with IDD, become frail at an earlier age. And that is consistent with the appearance of cognitive decline related to Alzheimer's and those sorts of things. But that's still preliminary work. There hasn't been extensive research done on that to control for a lot of other factors. All right, so thank you for your answers on that. So what we are learning then about frailty, and we've done written papers on this and have information on our website on that, is that the actual prevalence of frailty in adults with IDD is a bit unclear still. It really depends on the population that is studied, and so we do need to continue to monitor that and learn more about that. And we're learning that some factors are associated with frailty or with the rate of accumulation of deficit. In addition to Down syndrome, as we've already seen, our preliminary work has also shown that living in a group home is associated with a faster rate of deficit accumulation in this population. And of course, age is as well. So the older you get, the faster you accumulate these deficits. So what is clear, however, is that adults with IDD are more often frail than those without IDD. That has been found consistently in all the groups that have studied frailty using different measures in different populations. And it occurs at a much earlier age. Okay, we have another quick poll. So among adults with IDD, frailty increases one's risk of dying. True or false? And then among adults with IDD, frailty is irreversible. So I'll wait for you, Julia, to There we go. We're going to get the results. So among adults with IDD, frailty increases one's risk of dying. 93% said true. And in fact, our research has confirmed that. It's also confirmed that they're higher risk of hospitalization and of admission to long-term care. So frailty is a good kind of marker of, what may happen. Now, the follow-up question is this reversible? And 31% of you said true. Our research, actually we'll go to the next slide, Lynn, if that's okay. Our research shows that it is reversible. And we characterize individuals when we use our frailty index as non-frail, pre-frail, or frail. And the group that is pre-frail is the group that is most likely to, where we're most likely to have an impact in shifting from pre-frail to non-frail, but there's also a risk of becoming more frail in this group. So there is opportunity for reversing frailty in this population. It is not a stagnant construct. And that's a very important finding for us. And that led us to ask the question, well, what should we then do when someone is identified as frail or pre-frail? And in order to address that question, because there's not a lot of research on this topic, we put together an international group and engaged in a process of consensus building around what should be done, what are the actions that should be done when an individual is frail. And we've produced a consensus statement. And in terms of the international collaboration, we have on our team members from the US, other parts of Canada, including Manitoba, from Ireland, from Sweden, from the Netherlands. I think, oh, and yeah, that's it. And we did our consultation not only with these individuals, but using a network of individuals working in intellectual disability, the members of the International Association for the Scientific Study of Intellectual and Developmental Disabilities, and also individuals working in the area of aging through the RAI network of researchers. So I'm going to now turn it over to Tori, who's going to tell you about this consensus statement and lead you into the rest of the webinar.
Okay, so thanks, Hélène. So this consensus statement brought out two foundational principles. The first is to have a person-centered approach to planning, and the second is to have a focus on aging in place. And these two principles together were foundational for the following recommendations to be acted upon. So next slide, Lynn. The first recommendation is that frailty should be considered earlier for adults with IDD starting at around age 40. The second recommendation is that improvement and maintenance are viable goals during the planning process. The third recommendation is that since frailty is complex and spans multiple domains, intersectoral collaboration is necessary. Fourth, safety should be a priority during planning such that the person feels safe and secure. The next recommendation is the fifth, and it's that planning for the future is important, and this includes advanced care planning as early as possible. The sixth recommendation is that informal and formal caregivers also have needs and should receive necessary support and training. And finally, since this area of study is relatively new, the last recommendation is that the evidence base should be grown. So with all these principles and recommendations together, next slide, we get the full consensus statement for supporting adults with IDD who are frail. And though this statement is relatively new, we're curious to know if any of you have ever used it before or even heard about it prior to today. So if you wouldn't mind answering this quick poll question that'll come up, that would be great. And then if Julia, you can close it once you think we have enough responses, that'd be awesome. Okay, so the majority of you haven't heard of it before. That's great because now you get to learn a little bit more. Moving from this, we realized that the consensus statement and the recommendations that were built from it were created around hypothetical cases of pre-frail and frail individuals with IDD. And we were interested in knowing if care plans for adults with IDD that already existed actually addressed the principles and recommendations that we created. So we made a study where we examined 23 care plans for adults with IDD who were receiving support and services from a community-based agency in the GTA. 16 of these individuals were considered pre-frail and 7 were classified as frail. And they were classified by frailty status using the frailty index Hélène mentioned earlier. These care plans documented not only the deficits that the individuals had, but also the short and long-term goals that they had. And the care plans were updated over the course of the year to look at both outcomes and actions taken from the goals described. So to analyze these, the care plans were coded independently by 2 research team members, and the coding was based on the principles and recommendations from the consensus statement. So there were 2 messages that we didn't decide to code. The first recommendation, that frailty should be considered earlier, wasn't coded since our sample of care plans were for individuals who were 45 years or older, and they were already being supported with frailty in mind. Similarly, the last recommendation, that the evidence base must be grown, also wasn't coded because these care plans focused on the individuals rather than the research aspect. And before I show you the results of our study, we're interested to know what recommendation you consider to be the most important. So we're only focusing on the recommendations here. And if there are several people at your computer, please try to enter a response by consensus. But if you can't, enter single responses in the chat, and feel free to use the chat to explain your responses. Okay, so the majority, so 38% of you found intersectoral collaboration being necessary to be the most important, and that was followed by a tie with frailty being considered earlier and planning for the future being important. So that's really interesting. So if we can lead into our results. So we found that care plans most often documented goals that related to actually improvement and maintenance. So there were 70% of care plans mentioned goals relating to improvement and maintenance. And this was followed by intersectoral collaboration. So 65% of care plans mentioning this. And actually, we found that you can see on the graph that the recommendation mentioned least often was the needs of informal and formal caregivers. We also examined the principles as well, and we found that use of a person-centered approach was mentioned slightly more frequently in care plans than having aging in place as a priority. So to expand on these results a little bit, goals documenting improvement and maintenance were often focused in the physical and social domains, which might explain the slightly higher mentions. So changes within these domains might be more easily identifiable and might have more measurable outcomes, like transitioning from a wheelchair to a walker, which might explain why they were mentioned slightly higher. With regards to intersectoral collaboration, the higher mentions is likely due to the setting for the study. So our overall project, as you'll hear more about from Lynn in a minute, was focused on the coordination between the healthcare sector and the developmental services sector. So we weren't surprised by the higher mentions here. What was surprising though was the minimal and low documentation for the needs of informal and formal caregivers. So this could be a potential avenue for the consensus statement to provide guidance for future planning. But it might also just have been an artifact that supporting informal and formal caregivers is difficult to plan for, while designing goals for improvement and maintenance is slightly easier. So we're also interested in knowing which recommendation you would need the most help with for implementing in your own practice. And again, feel free to use the chat box to help explain your answer. Okay, so that's interesting. So the majority of people find that they would need the most help with furthering intersectoral collaboration, followed by planning for the future. So this is important because we are hoping to develop resources for the recommendations, and we'd like to know where to focus. But now I'll hand it over to Lynn, who's actually going to hopefully help with the answer to this full question, and going to talk to you a little bit about intersectoral collaboration.
Great, thanks, Tori. And I'm guessing that, you know, most people joked about this one being the most important and the one they need most help with. That's probably why you've registered for this. So maybe we've slightly biased, you know, the question here. But as Hélène mentioned, you know, frailty is complex. It involves a number of deficits within and across multiple different domains. So when people are identified as being pre-frail or frail, what we do recommend in the consensus statement that Tori has explained is that a comprehensive and multidisciplinary assessment of functioning take place, of physical and mental health, of medication use, of behavior, of the person's social context, of capacity for decision making, and available supports, right? So all of this needs to happen. But you also, in doing all of these assessments, need to think not just about the assessments individually, but also how they impact and interact with one another. It's a really big job. And again, given the emphasis and the desire to live and age in place in the community, the supports that are provided to individuals in the community by the developmental services sector, by the healthcare sector, the home care sector, to those who are identified as frail, really do become crucial, and we need for them to be working together. And so intersectoral collaboration comes into play, and it has been defined by Kang and colleagues as collective behavior, in which more than one agency or institution plays different roles in working towards common goals, right? So it's intersectoral collaboration isn't multiple agencies doing their own things in isolation, working in silos, you know, on the same thing. It's really about the coordination of collaborative efforts. And so this is the context in which we wanted to learn more about how this happens. So I'll just change slide. So, you know, we designed a case study that would explore how home care and developmental services sectors were collaborating in the context of supporting adults with ID who were frail, and where the case, you know, in quotation marks, is really the relationship between the two organizations. And so in this context, the Developmental Services Agency was providing, you know, residential supports, recreational, and day program supports to the three individuals who were identified in this study, whereas the Home Care Agency was providing things like assessment, nursing, referral, and occupational therapy services. So in this study, we interviewed a total of 23 people, including 2 adults with developmental disabilities, 2 family members, 13 developmental services providers, So that included frontline support workers, supervisors, care coordinators, managers, and administrators. And we also interviewed 6 people from the home care healthcare sector. And that included nurses, therapists, case managers, and administrators or decision makers. So we interviewed everybody, we transcribed what we were learning verbatim, and then we independently coded those interviews. They were independently coded by 2 members of our research team. And so as part of the work, about intersectoral collaboration, we wanted to know, what is known. And what we found was that, there is no literature that talks about intersectoral collaboration within developmental services or about developmental services, but there is some information out there about health. And there is some information on, best practices or the effective or the conditions that are needed for effective intersectoral collaboration that involves the healthcare sector. And so we use that information to guide the questions that we were asking the different people about how they were working together, as well as how we coded that. So I'll just go into that a little bit further here in terms of what are the key conditions for effective intersectoral collaboration involving health. What we found in the literature was that there are 6. And so you've got them listed here on your screen. And so as I mentioned, when we were interviewing people, we targeted these 6 different domains. So when we were to target necessity, we asked things like, when did you understand that you really needed to work together? When we were trying to target opportunity, we asked people, how they were supported to collaborate with individuals, with family members, with the other sectors. In terms of capacity, we asked if they felt they had the necessary skills and resources to collaborate. We asked about relationships, how did they describe the quality of the relationships with all of the different collaborators that were involved. We asked about the planned actions that they had, that came out of the collaboration. We asked about what were they and what were the roles and responsibilities of each of the sectors in organizing and in delivering those supports. And we also asked about sustained outcomes. So looking at, what are the outcomes and how were these being monitored within the sectors as well as across the sectors. So this was kind of the framework that guided our questions, but also how we coded the transcripts. And so I thought I would show you in a little bit more detail some of the elements that emerged in our literature review. So I mean, it's the 6 domains that came out of the literature, but there's over 20 different elements that could be classified under those 6 domains. And so, we asked about the necessity, and when we were coding in the transcript, these are the types of things that we were looking for, right? That they showed evidence that, yeah, we understood why we needed together. They talked about the shared values or shared goals. We noted that there were a range of perspectives that were discussed and present, right? That they talked about what they thought, what others thought. When we were looking for evidence related to the opportunity domain, we coded for things like there was evidence of they were supported by the organization. There was commitment of key stakeholders. There were champions who were saying, this is a great thing, we need to collaborate. We looked at whether or not there had been engagement early on in the collaboration by everybody who was involved. We looked at opportunities for people with lived experience and family members to be involved, very early on. When we're talking about capacity for intersectoral collaboration, we were looking at, was there the presence of either formal or informal arrangements to support that collaboration? Was there an understanding that was out there and articulated in some fashion? Did people have the knowledge and the resources that they needed to collaborate? We looked at, were people linking with one another within their sector, but also across the different sectors? And we also looked at, the power dynamics that existed. Was the power for chairing meetings, making decisions equitable across all of the different collaborators involved? We looked at how they talked about relationships. So we looked at, for things like trust, respect, that there had been some efforts to build alliances early on in the collaboration. Were people accountable to one another for doing what they said that they were going to do? Did they communicate? How did they communicate? Was it open, effective, and often, because we know that those things are important when you're working within a group. In terms of planned action, we were looking at, what people were doing and what people understood of their roles and responsibilities in those things, as well as what they understood about the roles and responsibilities of other people in the collaboration. Were they doing what they were supposed to be doing? Were the planned actions implemented? And were they being monitored and evaluated, to make sure that they were achieving these relevant and visible goals that they had articulated? We also looked for evidence of sustained outcomes, right? So we were looking at two things here mostly. Was there evidence, or did people talk about there being mechanisms in place to support the ongoing nature of this collaboration? To sustain it, but was there also mechanisms in place to support ongoing monitoring and evaluation of the outcomes that they were seeing as a result of this collaboration? So we asked about a lot of things and looked for a lot of things in the transcript, but we thought we would again engage with you in this poll question to see if you feel that whether you feel there's a domain that is most important for effective intersectoral collaboration. And again, the poll is open, and if there are several of you at the computer, if you can enter a response by consensus, great. If there isn't a consensus, please use the chat box to let us know what the responses of the various people at the computer are. So just looking to see if there's one that comes out for you as being the most important. And again, I'm going to rely on Julia to close the poll when there is sufficient answers, I guess. Okay. So I see some people using the chat box. Okay, it looks like the poll is closed, and it looks like the one that's emerging, there's a good distribution, but that relationships is emerging as most important, followed closely by planned action, and then you've got opportunity, capacity, and outcomes following that. The one that was voted on, I guess most important least, was the necessity domain. So I'll now share with you some of our results from the study. What we found was that, in looking at the transcripts and all of the responses and how they talked about all of these different things, we found that all of them were relevant in the context, and all of the 6 conditions were touched on by all of the participant types with one exception. We found that sustained outcomes were talked about by the providers in both sectors, but not by adults with developmental disabilities or family members. We did find that, again, professionals in both sectors touched on all 6 domains and how they talked about the collaboration, whereas people with ID did touch on, not on sustained outcomes at all, but mostly on the relationships domain, which really emerged as being, most important to them, but they did also offer some comments related to the 4 others. We also looked at not just what they talked about, but how they talked about the different domains and the different elements. And we saw that many of these were described as being facilitators. So things that when present really helped people to create and maintain the collaboration. And here again, relationships emerged as being most often discussed as a facilitator. So they talked about how the development of the relationship was important to the collaboration and had been supported by champions in their sectors, like saying it's so important to build these relationships, to get to know one another, to find time to talk, all of those types of things. And all of the participant groups touched on the importance of trust and respect, and how these had really contributed to maximizing the collaboration, maximizing how they were able to work together and build on their various strengths, how this trust and this respect really helped them to be able to ask questions of one another, like to help them clarify, you know, what was needed, clarify the goals, clarify those processes, and how that had been important really to maintaining that collaboration throughout. So they also talked about, though, in terms of planned actions, you know, how they had experienced rewards from the collaboration, including knowledge gained, new connections that emerged through this participation, and how those new connections had helped them, you know, just for supporting the individuals as part of the study, but also how they were now seeing new opportunities for other individuals that they were also supporting, right? These rewards were seen as important benefits from the collaboration and made them want to continue working in this way. Visible results were also presented as an important positive element to the planned action domain. And what they talked about was how, you know, when there were noticeable, when they saw that all of their efforts were leading to noticeable and notable changes in the person's mood, in their activity level, that they were achieving some of the goals that they had set out, you know, that made it seem really worthwhile to the participants, right? And so it made them, again, want to continue. They also talked about things that, when absent, really acted as a barrier to effective intersectoral collaboration. And I mean, it's important to keep in mind that this was like a year-long project and a year-long collaboration that they were reflecting on. And, you know, they talked about how things had improved over the course of collaboration, but there were some comments about some issues at very early on that made it for a little bit of a bumpy start. And those really related to, you see them there, the 4 domains that are listed. So they talked about early on, it was difficult to really know who the team was, right? So still taking a little bit of a siloed approach in terms of, well, there's our team and their team, and then how we come together. And that did change over the course, you know, again, of the project, but how the failure to kind of link and become the team right from the start led to some issues in terms of maybe not fully developing the goals, the shared goals together, not really understanding why they were working together, you know, right from the start, or feeling committed to this, you know, right from the start. They also talked about some lack of formal arrangements or knowledge of formal or informal arrangements, which from the start, which they felt made it difficult for them to know, you know, well, what time and resources can I devote to this? You know, how is this working? You know, how much am I devoting to working together to the collaboration versus to the actions taking to support the individual? So that meant that some were maybe more reluctant from the start. And so one of the big things that emerged was that they felt that having more resources and tools to help them with collaborating would have been really useful for them in how they work together and in sustaining that over time. And so that's basically, you know, what we've moved on to doing, is trying to fill this gap by both creating resources related to intersectoral collaboration, but also curating them, knowing that these things do exist out there, and trying to bring the best of that together. And so we've developed this infographic that highlights the key elements that arise from our work and from the literature. And we're also bringing this intersectoral collaboration to life through a video, which is really aimed at professionals working in the sectors, and both will be available in English and in French. We're also developing resources for individuals with developmental disabilities and family members. So throughout our work, we have been consulting with adults with developmental disabilities to hear from them and get their input on the infographics. And, you know, they said that they probably wouldn't be likely to go and look at a video, but they thought their parents might. But what they thought would be useful for them would be to have a workbook that they could have with them and make notes in, and that explained all of the different things. So those things are under development, and we've got plans to, again, collaborate and consult with adults with developmental disabilities on what we're developing to make sure that it seems usable and user-friendly for them. So I've got another couple of poll questions around you. You know, we want our resources to be used. So we would like to hear from you. How would you use these types of resources that we're sharing here with you today? You know, would you use them in your own practice? Would you share them? Would you use them in advocacy? Would you use them in all three of those different ways? Or are you not really sure about how you would use these things? Whether it's an infographic, a video, or if you had access to the workbooks as well. I see we've got about 12 minutes left, and so I'm hoping that folks are thinking really hard and responding, but that we might need to close the poll. So yay, it looks like you guys would be using them in multiple different ways. 60% said that they would use them, you know, in their own practice, share them, and for advocacy. And the next one is 20% said that they would share them with others. So thank you for that. So again, while all 6 elements are important to intersectoral collaboration, people's experience in doing these different types of things, organizational readiness, you know, might be different. And so we'd like to have this other poll question where we're asking you to help us prioritize our efforts in developing and creating and curating further resources related to each of these 6 things. So we've got the infographic that talks about the 6 domains and what's important, but we recognize the need for further resources for each of these things. And so for which domain do you feel you would need the most help with to implement them? You know, is it for the elements around necessity, opportunity, capacity, developing those relationships? You know, where do you think it would be useful to have more information and resources? If you could insert your answers, that would be great. Oh, it looks like there's a pretty even split across these different things, where 23% said sustained outcomes, 21% relationships, 19% are saying capacity, same for planned action, and necessity about 5%. So that's really, really interesting. And so I am following this up with yet another poll question, but I did want to let you know that we have started doing this work, right? For curating what is already out there around how do you do these different things. And we've identified just under 50 different sources of information. So we've got really thick reports, we've got journal articles, there are guides, there are self-assessments, questionnaires, there are checklists. And some of these deal with only one aspect, you know, they only deal with relationships, and some of them will deal with multiple different things. And what we're hoping to do is to put all of these together on our website to make resources available to individuals. But because we've got 50 of them, that's kind of unwieldy and won't be super useful, we think, to people if they're going to a website. Here's a list of 50 different things that you can try. So we'd like to know from you maybe where we should be looking, what types of resources are preferred. So we're asking here in this question, what types of resources would you most likely be using? And you can use the chat box if you want to explain. Do you prefer videos, infographics, comprehensive reports, research articles, workbooks, questionnaires or self-assessments? Do you want a checklist? Would you take an online course? Or are you equally likely to use, all of these? But if there is one that you're most likely, that would be great. Because again, it's helping us to prioritize. Oh, so people, for the most part, almost half of you have said you're equally likely to use all of those. So in a way, that's good. So that tells us that what we should be looking at is using, multiple different types of media and resources. And it looks like comprehensive reports, and checklists and online courses are the ones that probably are least likely to be used. So thank you for that. So again, we're trying to, we know that intersectoral collaboration is important, and we want to support people in doing that because we do know that it is difficult to do. And so we are doing our best to develop these resources. And so we will be posting them on our website. So in the coming months, please do look to our website. You can go there now. We have a lot of great resources, and I'll show you the website link in just a few minutes. But also wanted to let you know that we are, today's presentation focuses on intersectoral collaboration, but we are creating and curating resources related to all of the different elements in the consensus statement. So, looking at the 2 principles and the other recommendations as well. And we're looking to add those to our website. So the information that you're giving us today is important in the context of our efforts here for intersectoral collaboration, but we will be sharing them with our international colleagues, which Hélène talked about, who are developing and doing the same for the other pieces of the statement. So we thought we could open it up to questions if folks have them. I do see that there are some questions that are coming through both in the chat box and in the question and answer. So I've seen multiple times, can you please provide the presentation slides? And we will be doing that. So that's great to know that people are interested in those, and they will be available, Julia has noted, in the post-webinar resource package. And I'm also seeing a question here posted: what constitutes the pre-frail group? What factors are looked at to differentiate between pre-frail and non-frail groups? And so maybe what I'll do is turn that over to Hélène, since she discussed that in the first part of the webinar.
Great, thanks, Lynn. Yeah, that's a really good question. And it is not one thing, as I mentioned, with this approach of deficit accumulation. It's a question of how many more deficits. So a pre-frail person would have around 8 to 9 of the 42 deficits that we have identified in our measure, and a person who is frail would have 13 or more of the 42 deficits. So that's what distinguishes us, that tipping point. So with further research, we could potentially start to characterize better what a pre-frail individual might look like, but it's very individualized. It really dependent on the capacities that the individual has, sort of as they're aging, and what in all of these domains gets disrupted for them. So it's not any one thing. And that's why it can be difficult to identify the pre-frail person in particular, where there's a lot of opportunity to prevent further decline. So we very much advocate for assessments of frailty using validated measure in this population, so that in particular the pre-frail can be identified, because most of us can recognize a frail person it's a pre-frail person that's more difficult to identify. Lots more questions coming up.
I do see, and I also see a comment that was provided to the panelists just around, people wanting to find out more about ways to facilitate intersectoral collaboration. And I think that, the point of the presentation here today was to kind of talk to you about what those domains are and what are the elements within those domains that are important in doing this work. So I think that those two slides around the 6 domains and the framework that we used, are really important. And we tried to provide some results on, the things that were most important, in the context of supporting adults with ID who are frail. And we are looking through this presentation to get your thoughts on those, as well as to help guide us as to where the sectors need more help in actioning the different elements within the domain so that intersectoral collaboration is done more effectively and more smoothly. I'm just also seeing some additional questions around what type of in-house clinical services, in any, were present in the DS agencies involved in the studies. And I think that I'm going to go ahead and say that I don't think that there were in-house clinicians per se, but that the agency had very good relationships with different health services providers and home care in particular in that region, and did have, physical therapists, occupational therapists, and a nurse who were coming in on a regular basis, if that helps to answer the question. I'm also seeing a question around, can we share one or more frailty assessment tools? I don't know if Hélène wants to talk about that.
Yeah, we do have information on that from our work and the work of other groups, and then make some of that available. The problem with it is that it was relying on certain data being available to you. So our measure used the home care assessment tool, the RI home care. So it requires that you have that available, whereas other tools you can use with different data, but we'll certainly share that with everyone. We've done workshops on this before, so it is something that we've made available in the past.
Yeah.
Yeah, the group home comment, I see a question here, mentioned that folks with IDD compensate or become more frail while in group homes. What factors do you think lead to that? I did point out that this is preliminary result. It's very important to try to disentangle like what leads to being in a group home and how that might affect frailty and vice versa, and so it may be that the type of people who find themselves in group homes are the ones who will become more frail. So we do need to study that further. But at the moment, from what we could control in terms of sort of level of disability and other factors, age and so on, that there was a difference between those who lived in group homes compared to in the community or with their family. But we didn't have somebody mentioned something about an institutional group somewhere in the comments, and we didn't have an institutional group in that sample.
Yeah. I'm also just seeing, I know it's 1 o'clock and we need to sign off, but I am seeing some comments related, strategies to overcome barriers. So things like constant disruptions and collaboration partners. So tools that could support continuity, of those collaborations when people are changing, and people asking about, so I think that those are things that, we are looking for, in the tools that support each of the different elements that we would be posting, would be talking about those types of things. So, what are the challenges and how to overcome them? That is what we're looking to do, is to give practical resources on these things. And I saw a question about, what kind of barriers, structural or system, have you experienced when initiating intersectoral collaboration, and do you have any strategies to help resolve those? I think that, and I'll just answer on behalf of the team, but Hélène, jump in that I think the biggest barrier is not knowing about the different elements, right? So thinking about all of these different things all at once. So we often think maybe just about the relationships, but not thinking about the resources, the opportunities. How do we do all of these things? And so I think one of the things that we're interested in doing is developing resources to educate, like the infographic, like the video on intersectoral collaboration, so that people can know that all of these different elements are really important, and we need to spend time on each of them, not assume that everything is in place. We just need to focus on any one piece. So I hope that that helps to answer that. And we will be mindful in there. I've got the website up, mapsresearch.ca. So in the coming months, please do look for the section specific to intersectoral collaboration. There's already some really great resources and information there related to aging and IDD and frailty. And you're welcome to write us at any time, and our names are all, and emails are all there. And to say, hey, I'm looking for something and can't find it. Hey, here's a priority area. Can you help me? We're happy to engage with you. We want our research to be practical and meaningful, and to really support people who are involved in supporting adults with IDD who are frail. So I think we're gonna end it there. And as Julia said, any questions that we weren't able to get to here will be a part of the post-webinar communication pack, I think, that goes. And so we just want to thank you so much for taking the time to hear about the work that we have been doing, and for helping to guide the work that we will be doing in the coming months, so that it is more relevant to the sector and to individuals. And we ask that you please fill out the evaluation form after the webinar. So thank you very much.